This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson, and we've got a little bit of a special show for you this morning. We're going to be talking about the 2024 Bob Huggins Fish Fry. We've got three guests in studio this morning. We'll start left to right. David Goldberg, President and CEO of Mon Health System and Vice President of Vandalia Health. David, good to see you again, buddy.
Good morning, Dave.
Glad you're here. We've got Regan Siko, Director of Mon Health System's Oncology Service Line. Regan, good to see you.
Good morning, Dave.
And since it is the Bob Huggins Fish Fry, it would be appropriate to bring in the coach, Bob Huggins, joining us in studio. Coach, good morning.
Good morning.
Glad to have all three of you in studio. We'll get into the details of the Bob Huggins Fish Fry. I don't know if we need to do the whole background interview because, well, Coach's background, I think everybody's pretty familiar with that. David, you've been on a bunch of times, unless you want to talk about yourself for a minute.
I'd rather talk about something substantive.
All right, but Regan, I don't know have you been on the show before?
I have been on with Hoppy for
cancer
screening, but nothing.
Well, that doesn't count. Hobby doesn't count.
Hobby doesn't count.
Introduce yourself. Tell us a little bit about your background.
So I am from West Virginia. Been here and with Mon Health about almost 14 years. It'll be 14 years this coming August. I'm the service line director for Mon Health for oncology. So went to Wheeling Central Catholic for a couple years of high school, and then I'm from here and went to University High School, WVU graduate. So just happy to be here.
All right, guys. Thanks for coming in this morning. Really do appreciate it. Let's start with the origins of the fish fry. So I'll send this over to Coach. Coach, just what inspired the fish fry? What is it all about?
That's a good question. I wanted to do something to, honor my mother. My mother's grew up in Morgantown, grew up on 8th Street. If you go up 8th Street, the first house up there on the left, the big brick house, my mom grew up there. My dad grew up in Dug Hill. So I wanted to do something here in Morgantown that would be fun. And it just happened that it coincided with a basketball game. The basketball game, people were coming into town. It was a great time to have it. So we did it then, and it was a huge success, and it's just grown and grown and grown after that.
Could you have seen it growing into what it's become now? Because this is an annual mark it on your calendar event.
No, not really, not really. It was to raise money for people in need, and so we did that, and then fortunate enough to get hooked up with the Mon Health people, and my biggest concern after we had it going and everything were the people in the southern part of the state. It was rough for them. I mean, to come from the southern part of the state to Morgantown to get care, and Mon Health with their array of hospitals, I guess, is that the right word?
Yep.
It makes it much easier for them, and so we wanted to partner. My brother Larry got involved, but it was all about I watched my mother die of cancer, and sat at my mother's side for probably a month until she passed away, and just to sit there and watch her suffer and hold her hand was it hit me that we need to do something, or try to do something, and so that's what we did, and we've raised a lot of money for cancer research, and we'll continue to do so.
David, why was this an important venture to get involved with for Mon Health and Vandalia Health Systems? Why get involved in this? Why was this so important?
So, like the coach, it's personal to me. I think I've shared before. My mother has been, thank God she's doing well today, but the Mon Health oncologists have treated her, and she has stage 4 lung cancer. So it's important to me to find an opportunity, and when the coach reached out and said, we've been doing this for so long, many people don't realize that we have a very large cancer service line across now Vandalia Health. Charleston Area Medical Center's Cancer Center in the southern part of the state is the busiest by volume patient count cancer center in the state. Very accessible for people from Ohio, southern West Virginia, central West Virginia, and then you bring that north with Beckley Oncology joining our family a couple months back. We offer services at Tays Valley and Putnam County, and of course coming up 79 at our Stonewall Jackson Memorial Hospital. Davis Health System joined us in December, and we have full-service cancer care there. Into Morgantown, Preston County, we offered chemotherapy. So when you look at, the coach had a great analogy, it's like the Pony Express. When you think about bringing care to people rather than people to the care. So Vandalia has been purposeful, and we think this is a great opportunity to improve access, bend the curve, if you will, related to cost and bad outcomes. And partnering with the coach and his family and his legacy is only going to make it better for us to treat people.
Who are the benefactors from this year's Fish Fry?
Vandalia Health's Oncology, the miners, and of course the coach's family has an endowment fund, a foundation fund, that will be the recipient of all those dollars, and then they're going to disperse those funds from that.
Joining us in studio this morning, David Goldberg, Regan Siko, and the coach, Bob Huggins. We're talking about the Bob Huggins Fish Fry 2024. Coach, what can we expect for this year's Fish Fry?
Well, Pete Rose is going to be there. I think we can expect just about anything. Pete's a great guy, and then I spent a lot of time in Cincinnati at the University of Cincinnati and got to know Pete well, and we're just going to have fun. I mean, I think everybody's had a great time in the past, and just want to continue. I think it's a time where people can come in and fellowship, because there's generally a lot of people there, and just have fun, just enjoy. It's the time of the year when it's kind of gets dead around here, and I thought this was a great time to start this, and it's been a huge success. I mean, the people that we've had here, Jerry's been here, Hot Rod's been here, Rod Thorne's been here at the Fish Fry, and people have been extremely receptive to the Fish Fry, and the food's good. The food's good, and it's entertaining.
It ought to be very entertaining if Pete Rose is there telling stories.
Well, can you imagine Pete Rose and Meg Bulger? Meg will hold her own, and that'll shock Pete, I think.
Spent some time with her down at the girls' basketball tournament last week, and she can hold court with anybody, both literally basketball and when it comes to telling stories. So I believe you. I would like to sit in on that conversation. Just sit back, not say a word. Just sit back and listen to those two go back and forth.
You're welcome. You can sit on stage or backstage or anywhere you want.
Joining us in studio this morning, Coach Bob Huggins, David Goldberg, President and CEO of Mon Health System, and Regan Siko. Regan, I haven't forgotten about you, but we got to get to you after the break. Got to take a quick break. We're talking about the Bob Huggins Fish Fry 2024. When is the Fish Fry? What's the date?
April 6th.
April 6th. And what time?
5:30.
5:30.
We got to make sure people know when, where. Those are the important questions, right? We'll continue our conversation. Special edition of Mon Health Talk this morning. We're back in a moment on WAJR.
It wasn't 5:30.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, President and CEO of Mon Health System, David Goldberg, Regan Siko, Director of Mon Health System's Oncology Service Line, and the coach, Bob Huggins, as we get ready for the Bob Huggins Fish Fry 2024. It comes up April 6th. You can purchase tickets at bobhugginsfishfry.org. And benefactors this year, of course, the Norma May Huggins Cancer Endowment, Vandalia Health, and Remember the Miners. All right, Regan. You can't just come here and hang out. You got to answer at least a couple of questions. Tell us more about the cancer services that are offered through Vandalia Health and Mon Health System.
Sure. So we have multiple locations in the north. We have Stonewall Jackson Memorial Hospital, which has full infusion services, oncology services, chemotherapy, immunotherapies, different things like that. We have Mon Health Medical Center. We have radiation oncology, gynecologic oncology, medical oncology, and a full-service infusion center. And this past October, we were extremely happy and proud to offer full-service infusion chemotherapy and medical oncology services in Preston County. That was really big for us because we really wanted to get out into Preston County. We noticed within our service line that it is really hard for people to kind of get chemotherapy. They could come in every day, they could come in weekly, they could come in every 3 weeks, but it's really access to care, like Coach talks about, that can kind of inhibit people's ability to fight these diseases. We really pride ourselves getting out into the community, getting out into those areas to be able to get patients the care that they need. Access is always an issue, and with Mon Health and Vandalia Health, that's what we really strive for, to get our physicians out there into those communities and get those services out there to get patient access to care, and not just care, but timely care, be able to get the treatment that they need where they live and in a timely fashion.
Do you find that patients are pleasantly surprised when they learn, if they're living in Preston County or one of these other areas, that you don't have to go all the way to Morgantown for treatment? You can get treatment in Kingwood and these other areas as you reach out into these communities.
They're absolutely thrilled to have that close to home. We've actually seen patients say, well, if I have to go to Morgantown, maybe I just won't get treated. Maybe I'll just go home and it is what it is. So when you can get access to care close to home, it's big for the patients, it's big for the family of the patients, the caregivers, everybody involved. It gives them that hope, and it gives them that ability to fight and to have that comfort, and everybody to be able to fight with them. So yes, being in their communities and being close to home is absolutely imperative to them, dealing with these situations.
And David, on the more broad scale with Mon Health System and Vandalia Health, this has been a priority, not just with cancer services, but getting out into these rural communities for just, having regular health care available and, having physicians available so folks, again, don't have to go all the way to Morgantown or Clarksburg or Charleston or whatever the case may be.
Yeah, we've been telling the story. I've been here now a little over 5 years, and, we have a rich legacy of getting our providers into the communities they serve. Before Davis Health System joined our health system, we had a very robust cardiology practice there, and continue to partner with Davis today to bring cardiologists, electrophysiologists into the community where the people are. Heart disease is one of the biggest issues we have in our state, and our doctors go to where the patients are. And as Regan shared, cancer is a significant issue for us in our state, and it's important for us to be where the patients are. We want to break down the barriers to get care to them so they can get the care they need close to home. Nothing is more important than the support system that comes along with the patient, and if we can bring it close to home, then there's an even better fighting chance that people will be cured or have better quality of life with the people around them to get the care they need.
And Coach, with the Norma May Huggins Cancer Endowment and the foundation, what are some of the things you've been able to do through that foundation to help, David Goldberg and Mon Health and some of these, reach out into these rural communities and get people care?
Well, we did it for quite a while with University Hospital and the Cancer Center there. And I went through and tried to talk to some of the patients and, ask, is there anything that we can do to make this better and easier for you? And I think just about everyone, the ride that we have from where we live in southern West Virginia to here it's just too much. And there wasn't anything. I mean, people went up and went to the hospital and got care, but I joke around with David a little bit about the Pony Express. I'm kind of simple. So growing up in Doug Hill, I watched Lone Ranger a lot, so I thought, what the heck, there's a system from southern West Virginia up now where people can drive their car, they can stop, they can go in, they can be treated, they can be looked at, they can rest, and that wasn't available before. And now that that's available, I think those people, that certainly will help their chances of a better outcome. And that's what's important. What's important to me is the outcome, that we were in some small way helpful in those people being able to lead a life that's way more comfortable than what maybe it was before.
And Regan, one, how excited were you when this partnership came together? And two, how will Mon Health System and Vandalia Health as a whole benefit from this partnership?
I couldn't be more excited when we heard that Coach Huggins wanted to be involved with Vandalia Health and Mon Health and Davis Health and CAMC. This partnership just, there's no ceiling to it. It will give us the opportunity to build and expand and offer services. And Coach, first thing he said was, how can I help? What do you need? With those questions, discussions have happened, and we just look to expand our services. Again, access to care, timely care. How can we help our patients get to the treatments that they need to get to? With all those things, it's just the partnership is just going to build those relationships, be able to expand our services, and be able to get patients the care that they need in a timely fashion. So we couldn't be more excited to have Coach Huggins and the Norma May Huggins Foundation partnership happening. It's wonderful. Thank you, Coach.
Along with the distance, West Virginians, sometimes we will go along. You know what? It hurts, but it'll go away. It'll be fine. Besides the distance, what are some of the big obstacles to overcome when it comes to treating cancer here in West Virginia?
I think access to care is a big one. The distance is there. We did something this past year at the Ball of the Year with our caring cottages. While they're here receiving treatment, it's, hotel rooms, different things like that. So we had the Ball of the Year where we're actually going to build caring cottages where our patients can stay overnight while they're receiving treatments at no or minimal cost to the patients and their families, so they can be together for those surgeries or those chemotherapies or radiation treatments here at Mon Health Medical Center. So it's expenses, the expense of the traveling, the expense of hotel rooms or different things like that. So we have financial counselors, financial navigators, we have breast health navigators, nurse navigators. All those things that we can put in place to take care of our patients and our patients' families are really important to us because we want them to focus on getting well, getting healthy, and just getting better. So anything that we can do to help them along the way, we have in place and want to take care of those patients.
Yeah, I'm glad you brought that up. And David, I'll let you talk about this briefly because we are quickly running out of time. When it comes to Mon Health, whether it's cancer or whether it's something else, speaking to all these physicians over the several years I've done this program, it's not just about treating that particular ailment or treating the cancer. There's wraparound services, there's support services for spouses and family members to help, like Regan said, not just treat, I guess, the ailment, but get somebody and their family well.
Yeah, I think you said it. You asked the question a moment ago, what prevents people from care? I think people are scared, rightfully, the unknown. So if we can make it simple and bring the accommodations close to home so families can stay close to their loved one, if we could have social workers and counselors available to walk them through the process, if we could have navigators to navigate them. I lived through it. Luckily, I know healthcare, but my mother didn't, my sister didn't, who had to help take care of her, but the people around Mon Health did. And they made it easier for us to go through the journey. And with what the coach and his family are going to do is give us those extra resources to make it better for the patient. All
right, Coach, you'll get the final word here. How proud would your mother be of all the work that you've done with this foundation and the endowment and trying to help West Virginians?
Well, I think my mother was really proud of me as a basketball player and as a student and everything else. But this is way over the top. I mean, sitting there holding my mother's hand and watching her die of cancer was absolutely brutal. And I mean, I sat there and tears running down my face, and my mom was, "Bobby, it'll be okay. I'll be fine. I'm going to go meet the Lord." And that was just it's the hardest thing that I've ever done. And I've got 6 brothers and sisters, and so we're trying to let one go in and one go out, so everybody could go spend time with our mother. But it's a terrible, brutal disease, and to sit there at bedside and watch people die is just it's the hardest thing I've ever done in my life, without a question. And that's when I said to my mother, "I'm going to try to do something, Mom, to help." And started that when I was at the University of Cincinnati, did some of it when I was at Kansas State, and then coming home here to West Virginia and Morgantown, and having grown up here and watched all of this, I'm so happy and proud and excited about being a partner with these folks sitting here because they care. And to me, that's the most important thing. I mean, let's care and let's do everything we can possibly do to make it better.